Welcome to Orangetown Pediatrics. We are so excited to share the office with you. Orangetown Pediatrics was established in 1974, serving families of the Orangetown community for decades. We are proud to take care of children and even grandchildren of patients. We are 6 general pediatric providers, 4 of whom are doctors, 1 physician assistant, and 1 nurse practitioner. We also have a lactation consultant, a dietitian, and a mental health nurse practitioner. Monday through Friday from 8 a.m. to 9 a.m., a provider does a call hour or answers the telephone, so parents can call with any questions they may have. We can answer questions about behavior, constipation, feeding, and more. After 9 a.m. and all day long, we have a phone nurse to answer questions or direct patients to the physicians when needed. A medical provider is on call 24/7. We answer all calls until 11 p.m. and then we sign out to a registered nursing call center. The nurses follow the American Academy of Pediatrics protocols and always fax us documentation of the conversation so we can follow up with families the next day. We see newborns in the office within a few days after discharge, a week later for a weight check, at 1 month of age, and then monthly until 6 months, and bi-monthly until a year. This allows us to keep a close eye on your baby's growth and development. Our full well visit schedule can be found on our website, along with well visit handouts for most ages. All of our breastfeeding moms see our lactation consultant. Our picky eaters, vegetarians, patients with food allergies, patients who struggle with weight, and our competitive athletes are offered appointments with our dietitian. Any patients with ADHD can see our mental health nurse practitioner. As you can see, we try to keep our patients under one roof when possible. Patients are patients of the entire practice, and we believe in collaborative management. That is why we all share one office space. We regularly discuss patients with each other for additional guidance, especially if we are following your child for a specific issue. We encourage you to meet all of us as we share the evening and weekend on-call schedules. We always like to know the families we are talking to. However, you're welcome to see whomever you choose if you have a special request. This is an example of an exam room. All of our medical records are electronic, and we share records with most of the pediatric subspecialists at Maria Ferrari Children's Hospital, as we are all part of Boston Children's Health Physicians. Our exam rooms are family-friendly with enough space for strollers, siblings, and multiple family members. We have Apple TVs in each exam room, which are helpful in soothing children who may be upset during the visit. We have 2 weigh stations in the office nearby to the exam rooms. After the measurements are taken, the medical assistants and nurses enter the numbers into the computer so that the provider can review them before coming into the exam room. This is our hearing, vision, and vitals room. We screen babies' vision starting at 6 months of age and continue through adolescence. We also do routine hearing screening at well visits too. We follow the vaccination schedule of the American Academy of Pediatrics, starting with hepatitis B in the hospital. We are strong vaccine advocates as we feel vaccines are the best way to protect children from preventable illnesses. A copy of our vaccine schedule, as well as the vaccine information sheets, can also be found on our website. Babies receive their vaccines in the exam rooms, but teenagers who come in for vaccine-only visits receive them in here. All vaccines administered in the office are sent to the New York State database to keep all of the records in one place. We match up 1 medical assistant or nurse to a provider, which helps keep the flow moving nicely. We do our very best to respect your time, stay on schedule, and work efficiently. This is our treatment room. It is equipped with a stocked emergency cart. However, we hope that the worst procedure we do in here is remove a splinter or some earwax. We have an on-site lab for rapid testing. We perform quick streps, RSV tests, flu swabs, urine tests, and capillary blood tests like hemoglobins, leads, and cholesterol. We find our families really appreciate getting the results before they leave the office. We hope this virtual tour has given you a broad perspective of the practice. There is lots more information on the website, so please browse around. If you have any questions, please don't hesitate to call. We hope to see you soon!